Have you ever looked at your toothbrush and wondered if it could save your life? What if I told you that simple, everyday hygiene habits, things as small as trimming your nails or taking a shower, could be the very difference between early detection and a health crisis? Doctors see it all the time. They walk into a routine checkup, glance at a patient's gums, their feet, their skin, and instantly know something's wrong. The truth is, your body doesn't stay silent, it whispers. But are you listening? In this video, we'll reveal 7 personal hygiene mistakes that seniors often make. Mistakes that seem harmless but could be the first signs of serious health conditions. You'll hear real stories, surprising science, and practical tips that could literally save your life, or the life of someone you love. Don't wait for a diagnosis to start paying attention. Stay with us, and find out what your body's been trying to tell you all along. 1. Neglecting oral hygiene. The silent danger hiding in your toothbrush. Most people think poor dental care leads to cavities, bad breath, or maybe a few missing teeth. Annoying? Sure. Embarrassing? Definitely. But life-threatening? That's where most of us are dead wrong. What if I told you your toothbrush, or lack of using it properly, could be the very thing silently putting your heart, your brain, even your life in danger? Let me introduce you to Sylvia. She's 68, a retired schoolteacher from Oregon, and the kind of grandmother who bakes cookies from scratch and never misses a birthday. For years, she ignored her bleeding gums, brushing off the discomfort as just part of getting older. After all, everyone's gums bleed a little, right? Wrong. Sylvia went in for a routine physical and left with a diagnosis that shocked her family to the core. Dangerous inflammation in her heart valves, directly caused by oral bacteria that had traveled from her gums into her bloodstream. Her cardiologist told her if she had waited even a few more months, the damage might have been irreversible. All from bleeding gums. Here's the truth doctors know but many never say loudly enough. Poor oral hygiene is directly linked to heart disease, stroke, and even dementia. Harvard Medical School geriatric specialists found that seniors with untreated gum disease are 3 times more likely to suffer from cardiovascular complications. And yet, most of us don't give our toothbrush a second glance. So let me ask you, when was the last time you really looked at yours? Is it frayed, flattened, old? Be honest, has it been sitting in the same cup for 6 months or longer? Are you brushing thoroughly twice a day, every day for 2 full minutes? Or are you giving your teeth a quick swipe and calling it good? If your answer makes you hesitate even a little, it's time for a change. It's time to take this seriously, not just for your smile but for your survival. Here's what you can do starting today. Replace your toothbrush every 3 months, or sooner if the bristles are worn. Upgrade to an electric toothbrush. Studies from the University of Pennsylvania Dental School show it removes 62% more plaque than manual brushing. Floss nightly, no excuses. See your dentist regularly even if you have dentures. And most importantly, don't ignore bleeding gums. Don't normalize pain. Don't shrug off discomfort. Your body is whispering that something is wrong. Please don't wait until it starts screaming. Because what seems like a small hygiene slip could be your heart's first cry for help. And sometimes it's not just about saving your teeth. It's about saving your life. 2. Not bathing regularly enough. When skipping a shower could be hiding something life-threatening. Let's be honest, bathing feels different as we age. The cold hits harder. Our skin gets drier. Moving in and out of the tub can feel more like a chore than a comfort. So many seniors quietly cut back. Once a week, maybe twice. I'm not sweating much these days, they say. Why bother? But what if I told you that skipping your shower could be hiding something much more dangerous than a little body odor? Meet Clarence. He's 77, a retired postal worker from Michigan. Tough guy. Worked through blizzards and blazing summers. And like a lot of older folks, he thought bathing once a week was good enough. Especially in the winter when the dry air left his skin feeling like sandpaper. He had no idea something deadly was beginning to show, right there on his skin. During a routine doctor visit, Clarence's physician noticed a subtle discoloration on his lower back. Nothing dramatic, just a slight shift in color, like a shadow that didn't quite belong. Tests followed. The verdict? Early-stage kidney disease. It wasn't the skin itself that caused it, it was the lack of bathing that delayed the discovery. That simple, well-meaning attempt to protect his dry skin? It nearly cost him his life. According to dermatologists at the Mayo Clinic, your skin is your largest organ, and it often reveals internal problems before anything shows up on a blood test or X-ray. In fact, nearly 40% of undiagnosed medical conditions in older adults could have been caught earlier, just by paying closer attention to their skin. So let me ask, when's the last time you really looked at your skin? Not just your face or hands but your legs, your back, your feet? Do you notice dry, flaky patches? Discoloration that wasn't there last month? Itching that just won't quit? These aren't just signs of aging. They might be your body quietly waving a red flag. What should you do? Bathe at least 3 times a week, even if you're not very active. Use mild, fragrance-free soap to protect your skin's natural barrier. After bathing, moisturize while your skin is still damp. This locks in hydration and helps prevent cracking. And most importantly, examine your skin regularly. If something looks off, feels strange, or just doesn't go away, talk to your doctor. You see, proper bathing isn't just about feeling fresh. It's about catching the whisper of a disease before it becomes a roar. Clarence was lucky. His doctor caught the warning just in time. But not everyone gets that chance. So next time you consider skipping the shower, remember this. It's not just a routine. It's a ritual of self-respect, a quiet act of protection, and sometimes, just sometimes, it's the moment that saves your life. 3. Neglecting nail care. The truth hiding at the tips of your fingers. We don't think about our nails much. They're small, quiet, and easy to ignore. As we age, we stop painting them, stop clipping them as often, maybe even stop noticing them altogether. Thick toenails? Must be age. Yellow tinge? Just old feet. Right? Wrong. So very wrong. Your nails are tiny windows into your health. And sometimes they're the first to show something's gone very, very wrong. Let me tell you about Beatrice. At 82, she's sharp, funny, and full of stories about raising 5 kids and living through 4 recessions. But her toenails? She hadn't really looked at them in years. They'd thickened, turned a little yellow. She simply stopped wearing sandals and tucked them into socks. It's just age, she told herself. But pain started creeping in. A deep ache in her toes. When she finally saw a podiatrist, he didn't just see toenails. He saw signs of a long-ignored fungal infection, one that had thrived unnoticed for months, maybe even years. But that wasn't all. The real shock came next. Her immune system was severely suppressed. Further tests revealed a serious internal condition, something Beatrice never would have caught if she hadn't finally taken off her socks and let a doctor look. And she's not alone. The American Academy of Dermatology reports that changes in nails can indicate over 20 different systemic diseases, from anemia and thyroid dysfunction to heart and kidney conditions. In people over 65, nearly 30% of internal health issues were first spotted through nail abnormalities. So take a moment, right now, and look at your nails. Are they brittle or ridged? Discolored or unusually thick? Are they clean underneath? Trimmed evenly? These are not just cosmetic concerns. They're early warning signs. They could be your body's way of screaming, "Look at me. Something's wrong." Here's what you can do today. Trim your nails regularly, straight across with slightly rounded edges to prevent ingrown nails. Keep them clean and dry, especially toenails, which are prone to fungal infections. Wear breathable shoes and fresh socks daily. Moisture and heat? Perfect environment for infections. And if you notice any sudden changes, color, shape, texture, pain, see a medical professional. Don't wait. Nail care isn't vanity, it's vigilance. And for Beatrice, finally looking down saved her from something far more serious than ugly toenails. You might not think your nails say much about you, but to a trained eye they speak volumes. And sometimes, they whisper the very thing that saves your life. So don't wait. Roll up your sleeves. Take off your socks. Look closely. The truth could be right at your fingertips. For poor management of incontinence. The quiet struggle that too many seniors hide, and it's costing lives. Let's talk about something that rarely gets talked about. Something uncomfortable, private, even embarrassing. Incontinence. Over 50% of seniors experience some form of it, leaks, urgency, accidents. And yet, the majority suffer in silence. They don't tell their doctors. They don't tell their children. They manage it in secret with paper towels, extra clothes, even denial. But here's the shocking truth. What you're trying to hide could be the very thing that's hiding something much worse. Douglas was 73 when his secret caught up with him. A retired accountant from Arizona, he prided himself on being composed, private, in control. So when the occasional leak started, he brushed it off. Just getting older, he thought. He carried spare underwear, used makeshift pads, cleaned up as best he could, and kept going. Until one day the soreness became unbearable. He finally saw a doctor, more out of necessity than willingness. What they found? Advanced prostate issues. A condition that had been developing silently for months, maybe years. Had he come in earlier, when the first symptoms appeared, it could have been treated easily. But now, the options were more limited, more invasive. The cost of silence? I thought I was being strong by keeping it to myself, Douglas admitted. Turns out I was just gambling with my life. Incontinence isn't just an inconvenience. According to Johns Hopkins Medicine, untreated incontinence can lead to dangerous skin infections, painful sores, social withdrawal, and even mask underlying conditions like bladder or prostate cancer. Seniors who seek treatment and manage it properly have 60% fewer complications than those who hide it. So if this is something you're dealing with, stop hiding. Start healing. Here's what you can do. Talk to your doctor. They've heard it all. Nothing you say will shock them. What's truly shocking is staying silent. Use proper absorbent products, designed for your comfort and health, not makeshift solutions like paper towels or toilet tissue. Change promptly when wet and follow a gentle cleansing routine to prevent skin breakdown. And most importantly, understand this. Incontinence is not a normal part of aging. It's a sign that something in your body needs attention. Are you avoiding outings because you worry about finding a restroom in time? Planning your day around your bladder? Using layers of protection just in case? That's not independence. That's isolation. And you deserve better. Douglas nearly lost his life because of pride. Don't let the same happen to you or someone you love. There's strength in speaking up. There's dignity in asking for help. And there's freedom in taking control of something that's quietly been controlling you. Let today be the day you choose health over hiding. Because the sooner you face it, the sooner you start living again, fully, freely, and fearlessly. 5. Improper ear cleaning. The dangerous mistake you're making with a cotton swab. There's a familiar sound that echoes in countless bathrooms every morning. The snap of a cotton swab container. The quick twist of a Q-tip. For many older adults, cleaning inside the ears is just part of the routine. Something you've done for decades without a second thought. But what if that tiny stick of cotton was quietly causing irreversible damage? Patricia never saw it coming. She's 71, a retired librarian from Washington, a woman who'd always done things by the book, including her hygiene. Every morning she'd gently clean her ears, just like she had since she was a teenager. I thought I was being careful, she said. I thought I was doing the right thing. Until the pain came. Sudden. Sure. Unrelenting. By the time she got to the ER, her eardrum had ruptured. The infection had spread to surrounding tissues. Patricia, someone who never missed a book club meeting, was now undergoing emergency treatment for something entirely preventable. Her doctor gave it to her straight. The cotton swab caused this. Patricia was stunned. No one ever told me not to. I'd been doing it my whole life. And that's the heartbreaking part. So many seniors simply don't know that this everyday habit is doing real harm. According to otolaryngologists, ear specialists, improper ear cleaning causes nearly 40% of ear canal injuries in people over 65. Many of these cases lead to painful infections, hearing loss, or worse, conditions that could have been completely avoided. Let's be clear, you should never insert anything into your ear canal that's smaller than your elbow. Yes, your elbow. That itch? That feeling of fullness? That wax you think needs to be scraped out? Your ears are self-cleaning. The wax works its way out naturally. When you interfere, you risk pushing it deeper, or worse, tearing delicate tissue. So what should you do instead? Clean only the outer part of your ears, the visible area, with a warm, damp washcloth. If you feel there's excess wax, use ear drops designed to soften it, following the package instructions carefully. And never ignore signs like pain, discharge, hearing changes, or persistent itching. These are signals your ears need medical attention, not more swabbing. And if your hearing suddenly feels muffled or blocked, see a doctor. Don't self-treat. Patricia now lives with partial hearing loss. And every time someone reaches for a cotton swab, she winces. This didn't have to happen, she said softly. If just one person had told me the truth earlier. So here I am, telling you. Don't wait until the pain starts. Don't wait for the hearing to fade. Don't wait for regret. Your hearing is precious. Your safety matters more than your routine. And when it comes to your ears, sometimes doing less is the very thing that protects you more. 6. Neglecting foot care and examination. The warning signs hiding at your feet. How often do you really look at your feet? Not just a passing glance when you slip on your socks, but a real look between your toes, under your soles, around your heels? For many older adults, the answer is not often enough. But here's the truth that podiatrists know all too well. Your feet can be the first place your body whispers that something's gone wrong. Ignore them long enough and those whispers can turn into screams. Let me tell you about Raymond. Raymond is 76, a retired factory worker from Illinois. He spent his life on his feet, 12-hour shifts, 5 days a week, steel-toed boots, concrete floors. Tough as nails. After retirement, he slowed down, but the habit of ignoring foot discomfort stuck with him. His heels were cracked. The skin felt rough and dry. A few cuts here and there, nothing major, he thought. Just old man feet, he'd laugh. But during a routine physical, his doctor asked him to take off his socks. What he saw sent up red flags immediately. The discoloration. The slow-to-heal cuts. The subtle swelling. Raymond was sent for tests. Within days, he was diagnosed with early-stage diabetes, a diagnosis that might have taken years to catch if not for that quick foot inspection. If my doctor hadn't looked at my feet, Raymond later said, I could have ended up in real trouble, maybe even lost a toe, or worse. And he's right. According to the American Podiatric Medical Association, up to 85% of diabetes-related amputations in seniors could be prevented with proper foot care and early detection. That's not a typo, 85%. So why do we ignore our feet? Maybe it's because they're far away. Maybe they're not glamorous. But here's the reality, they're vital. Your feet carry you through life, and sometimes they carry the first signs of disease. Here's what you should start doing today. Wash and thoroughly dry your feet every day, especially between the toes, where moisture loves to hide. Inspect them closely. Look for cuts, sores, discoloration, swelling, or anything that wasn't there last week. Wear clean, dry socks made from natural or moisture-wicking materials. Moisturize dry areas, but avoid applying lotion between the toes. It can encourage fungal growth. And if you feel numbness, tingling, pain, or notice wounds that won't heal, see a doctor immediately. These aren't cosmetic issues. They're health alerts. Don't let silence cost you a limb. Don't let neglect cost you your independence. Raymond caught his condition in time, because his doctor cared enough to look and he was brave enough to listen. You can do the same. Every step you take matters. But first, take a moment to look at your feet, and listen to what they might be trying to tell you. 7. Hygiene side effects from medications. When the medicine that's helping you starts hurting you silently. Barbara never smelled it herself, but her daughter did. So did the neighbor, and eventually, even her pastor gently hinted at it. Are you feeling all right, Barb? She was. Or at least she thought she was. Barbara, 67, a retired nurse from Florida, was doing everything right. She bathed daily, used deodorant, kept her home tidy and fresh. Yet there it was, a strange sour body odor that seemed to follow her like a shadow. She was mortified. For weeks she scrubbed harder, changed laundry detergent, switched deodorants, but the smell stayed. Until one day during her regular visit to the geriatrician, she broke down. I don't know what's happening, she whispered, holding back tears. The doctor didn't flinch. He'd seen this before. It wasn't her hygiene. It was her medication. Specifically, a combination of prescriptions she'd recently started, intended to help manage her blood pressure and arthritis, was building up in her system, slowly affecting her liver. The unusual body odor? That was her body crying out, trying to detox through the skin. Barbara was experiencing early signs of medication toxicity, and had it gone unnoticed longer, the damage could have been permanent. Here's what most people don't realize. Many medications, especially when taken in combination, can cause subtle hygiene changes long before more serious symptoms appear. Changes like excessive sweating, dry mouth or odd taste, strange or sour body odor, a skin that becomes unusually oily, dry, or discolored. According to pharmacologists at the American Geriatric Society, nearly 40% of adverse drug reactions in seniors begin with hygiene-related symptoms, and far too often, those signs are dismissed as normal aging. But they're not normal. They're not your fault. And most importantly, they're not to be ignored. So what can you do? Keep a simple journal when starting any new medication. Note changes in how your body feels, smells, and reacts. Stay hydrated unless told otherwise by your doctor. Hydration helps flush toxins and regulate systems. Report any hygiene changes, no matter how small, to your physician. These may be the earliest signs of a problem. And never adjust or stop medications on your own. Always consult your doctor first. Barbara's story has a hopeful ending. Her doctor adjusted her prescriptions, and within weeks, the odor vanished. But more than that, Barbara regained something far more important than freshness. She regained confidence. People talk about health in terms of numbers, blood pressure, cholesterol, sugar levels, she said. But sometimes your body speaks in whispers. A smell, a dryness, a change. We just have to listen. So listen. Your body isn't betraying you, it's trying to protect you. Every change, no matter how small, matters. And sometimes, saving your life begins with noticing what you can smell, feel, or see, long before it ever shows up on a lab report. Final words: when hygiene becomes the first whisper of a deeper truth. As we grow older, it's easy to focus on the big things: cholesterol numbers, heart scans, memory tests. But sometimes, it's the smallest changes that carry the loudest warnings. A bleeding gum, a skipped shower, a thickened toenail, a faint body odor that wasn't there last month. These aren't just signs of age. They're the body's way of saying, look closer. Something's changing. Too often we brush off these shifts as just getting older. But the truth is, many of them are the first signals of preventable, treatable, and sometimes life-threatening conditions. And the earlier we listen, the greater our chances of staying healthy, independent, and fully alive. So don't wait for the crisis. Don't wait until the hospital visit or the diagnosis you never saw coming. Instead, start today by paying attention to your teeth, your skin, your nails, your feet, to what your body is showing you quietly, persistently, faithfully. Caring for your hygiene isn't just about cleanliness. It's about dignity, awareness, survival. And when you take those few extra minutes each day to look, to care, to act, you're not just preventing disease. You're honoring your life. Because sometimes the path to staying here, healthy, whole, and free, begins with something as simple as picking up a toothbrush and truly listening. Thanks for watching. Please comment with the number 1 key to let us know you watched the whole video. We are very grateful for this. Subscribe to the channel and remember to turn on the notification bell to see other useful content. See you in the next video.